Therapists, what's something people are afraid to tell because they think it's weird, but you hear often? Story 1. I'm early in my career as a trainee, so my pool of experiences is small, but I'm noticing a pattern with suicidal ideation, SI. Clients sometimes initially say there's nothing concerning, only to later admit, sometimes with shame due to their earlier response, that they've had passive thoughts of suicide, like, life would be so much easier. The reality is that nearly all of us have had such thoughts at some point. It's understandable. When starting therapy with a new client, we're legally and ethically required to inform them that one of the only reasons we would break confidentiality is if they express thoughts or plans of harming themselves or others. Because of this, the topic is approached with extreme seriousness and potential consequences. If a client has an active plan or a set date, it's taken most seriously. Police will be called. During my own therapy, I once responded to the standard question with, well, not more than the 20,000 times since I was born, referring to existential thoughts about the pain of existence. My therapist laughed and said he could relate, which felt like an appropriate response given our rapport. Story 2. A lot of drug use and self-medicating gets brushed under the rug, either because people fear legal trouble or because they don't see themselves as drug users. I've had many clients who were ashamed to admit they'd used street drugs. Often they present it as something they tried once in the past, only for it to later come out that they're still using. I think it can be difficult for the average neurotypical adult to understand how self-medicating actually works, and that sometimes it does work until it doesn't. Plenty of successful professional adults use substances like coca or meth without realizing they're actually trying to manage undiagnosed ADHD, anxiety, or depression. Others use alcohol or opioids without realizing they're attempting to balance a chemical shift caused by a depressive episode. Many people just think they like the way it makes them feel and don't analyze it beyond that, perhaps even less so with legal substances like alcohol or doctor-prescribed narcotics. But identifying someone's drug of choice can be an incredibly useful diagnostic tool in understanding what might work for them. Even knowing whether someone prefers uppers or downers can reveal a lot about their brain chemistry. Unfortunately, the stigma surrounding illegal drugs often leads clients to withhold the fact that they truly enjoyed how they felt when they smoked Hero that one time. Story 3. I work with adolescent males, and they often think it's weird or uncommon to cry or feel lonely. They see the men in their lives acting stoic and assume that being emotionally affected by life events is strange or a sign of weakness. Then there are intrusive thoughts. Many people struggle with them, especially violent or self-harming thoughts, and it makes them feel crazy. But intrusive thoughts are completely normal. What we think isn't the same as what we do, yet some people have difficulty separating the two. Honestly, human behavior covers a wide range of what's considered normal. The key is to remind yourself, unless your actions are negatively impacting your life or the lives of others, you're okay. Story 4. Domestic abuse victims, both men and women, are often stunned when I explain the cycle of abuse. Understanding it can be incredibly empowering, helping them realize they're not alone and that others have escaped and rebuilt their lives. Honestly, I find that simply validating their experiences without judgment, just witnessing their pain, is so foreign to them that when it finally happens, they begin to see life through a completely different lens. If you feel something, if you experience something, it rarely shocks a seasoned therapist, even though this is controversial when it comes to certain taboo urges. But keeping things hidden gives them power, allowing them to consume you and potentially harm others. Just focus on getting through today. Tomorrow's strength will come tomorrow. You have the strength to get through today. Story 5. I experienced postpartum psychosis. During an evaluation, I was asked what a coat and a blanket had in common. I asked them to repeat the question because I didn't understand. They repeated it, and I was still confused. I glanced at my husband and my best friend. Their faces looked shocked and sad. I thought, why can't I figure this out? I have no idea. After a stressful 10 seconds, I finally said, I don't know, and they cover you whole? I spent 5 days in a mental health institution while they adjusted my medication. Years later, my best friend told me how heartbreaking it was when I couldn't answer that simple question. I asked, what question? She said, what do a coat and a blanket have in common? I froze. A coat? She said, coat? I thought she said, cult. The woman who had evaluated me had a thick South African accent. I had misheard her. Finally, I understood why they had admitted me for 5 days. They cover you whole. Story 6. A few weeks ago, I was surprised by how much a particular session helped, especially since I was convinced it wouldn't. I had seriously considered canceling because I hadn't done any of my homework from the previous week. I was supposed to keep logs of certain activities to discuss in our next session, but I didn't do it at all. I figured, why even have a session if we have nothing to talk about? But I waited too long to cancel, so I just showed up and told my counselor, I don't know what we're going to talk about because I didn't do any of the work. She laughed and said she appreciated my honesty. As it turned out, I was really glad I didn't cancel, because it ended up being one of our most productive sessions ever. Story 7. I see a lot of parents struggle to be honest about parenting. I've worked with many families, often those with young children dealing with behavioral challenges. One common trend is that parents in these cases insist they love their kids unconditionally to an extreme degree. Some even claim, I don't ever get mad at them. They seem to believe that getting frustrated or mishandling situations, whether it's overreacting, lecturing too much, or just feeling overwhelmed, is a sign of failure. Many of them also refuse to admit they could use more help or learn new parenting techniques. That always gets me. I'm trained in multiple parent-child specialty areas, have children of my own, and even teach parenting classes. Yet I still want more information and new strategies. Wanting to improve doesn't mean you're a bad parent. In fact, the opposite reaction is more concerning. Anyone who refuses to believe they could do better will never grow, and that can lead to serious problems down the line. Also, parents need to understand that it's okay to take breaks. Leaving your kids with a trusted family member for a night or finding other ways to step away for a short time isn't neglect. It helps prevent burnout. Yet many parents feel guilty about it. They shouldn't. Taking care of yourself makes you a better parent in the long run. Story 8. I think one of the hardest things to admit is having an addiction, especially when you're deep in it, or when it's your only coping mechanism for dealing with trauma, mental illness, or post-traumatic stress. For many people with addictive personalities, the body naturally seeks out activities that provide a rush of dopamine, serotonin, or other feel-good endorphins. The problem is, addiction can make you rationalize destructive behaviors as if they're actually helpful. In my case, the hardest thing to admit was that I had a binge eating disorder. Throughout my struggle, I constantly convinced myself that my eating habits were justified, whether as rewards for a bad day or as nutrition that would somehow make me a better person. Food had an unhealthy power over me, and that mentality started early. My mother had an eating disorder as well. Sometimes she would starve us as kids. I later developed a genetic condition linked to malnutrition during pregnancy. It made me gain weight easily and caused high testosterone levels, something my mother hated because it meant she couldn't control my weight through conventional means. The hardest part? No one, including weight loss surgery doctors or the counselors they worked with, ever once suggested that my condition might be connected to an eating disorder. It took an actual eating disorder clinic, a doctor, a specialized nutritionist, and a counselor working together as a team for me to finally understand what was happening. In many ways, addictions, especially those seen as non-evil like gaming, gambling, or food addiction, are a last defense against deeper trauma buried in the subconscious. They act as shields, covering up pain we don't know how to face. After earning my psychology degree in 2012, I started learning more about childhood post-traumatic stress and how it shapes brain chemistry. It's worth looking into. Many addictive disorders develop as coping mechanisms for unresolved childhood trauma. When a parent fails to meet a child's emotional needs, addiction can fill the void. Food addiction in particular is one of the hardest to admit because it's so accessible. It's a quick, easy way to soothe pain and avoid unwanted attention. The related disorders, whether anorexia, bulimia, or binge eating, are all part of the same underlying struggle. It doesn't matter whether the person is underweight, overweight, or somewhere in between. If this resonates with you, don't be afraid to talk about it. But if your relationship with food is controlling your life, if you feel like your weight is the reason, you can't do the things you truly want to do, consider finding a proper eating disorder therapist before pursuing weight loss surgery. You deserve real help, not just a temporary fix. Story 9. I'm a clinical therapist in private practice. Lately, I've been really interested in this topic and have talked about it several times with my wife, who happens to be a school psychologist. We're a fun house. As a therapist, it's important for me to carefully consider the way a question is framed and how I respond. Words don't just have meaning. They carry connotations that can be misleading or easily misinterpreted, especially in a text-only format. I think the core of this question could be reworded slightly. What are some topics that people struggle or hesitate to disclose, but are actually quite common? I don't mean to change the question completely, and I hope I haven't here. I agree that fear plays a role for many individuals. For others, it might be anxiety or a sense of shame. Some people hold back because they think their issue is weird, or because they worry I'll think it's weird. For the record, nothing surprises a seasoned therapist. Others fear being judged, treated differently, or even reported to the authorities. Only imminent harm to oneself or others can break confidentiality, not other legal issues. I believe people hesitate to discuss certain topics because saying them out loud makes them real. They might not be ready to process what happened yet, and that's okay. Psychological defense mechanisms like denial serve a purpose. Therapy is about starting where the individual is, not where they should be. Trust has to be built first. So what are these difficult topics? Many therapists would identify the same general list: sexual assault, both survivors and perpetrators, abortion, religious guilt, intrusive thoughts about harm, both passive and active, and more. The key isn't just identifying what these topics are, but also normalizing them in a healthy way. Normalization is one of the most important aspects of therapy. Letting someone know, through empathy, understanding, and a complete absence of judgment, that their thoughts or feelings are common allows them to break down those experiences and process them. It doesn't matter if I've heard something similar before, or if it's my first time encountering a particular issue. All topics are okay to talk about because they are all part of the human experience. Ultimately, while our stories are unique, human experiences are often universal. That's the paradox of life. Our struggles are deeply personal, yet they are what connect us. Story 10. I've seen therapists on and off for over a decade. I'll be honest, my biggest frustration with therapy, or at least the therapeutic guidelines in the US, is that therapists often let me draw my own conclusions. Too often, they allow me to evade uncomfortable questions or give shallow responses, when in reality, I wish they would do the opposite and really push me. From my experience seeing 5 or 6 different therapists, my impression is that they're too soft, too afraid to challenge me when I put up walls. And yes, obviously, I could try not to put up walls, but the entire reason I'm in therapy is because I struggle to break them down on my own. I know this is a bit unrelated to the original question, so apologies for the tangent, but it's been my experience with therapy. I did have one therapist who was tougher, but instead of working through it, he just suggested I stop therapy altogether, which honestly was devastating. Story 11. I'm not a therapist, I'm a client. I have emetophobia, an ARFID, avoidant restrictive food intake disorder, because of it. I was bounced around between specialists for years because I never realized I had an eating disorder. It wasn't about body image or weight for me. My fear wasn't food. It was the idea of getting nauseous, throwing up, or anything related to that. I ended up in inpatient treatment for my eating disorder. As part of my discharge plan, I had to continue outpatient therapy. That's when I met my current therapist. At first, I was terrified to tell her about my phobia. I was absolutely convinced that it was unique, weird, something no one else had. Anytime I mentioned my fear of vomiting in the past, people would just brush it off with, "No one likes that." So during my first session, I sat down and blurted out, "I'm about to tell you the craziest thing, and I know you probably can't help me, and I know it's stupid and insane, but I'm terrified of throwing up. Not just disliking it. I mean, my heart pounds, I start crying, I can't breathe if my stomach even grumbles." She just sat there for what felt like the longest 30 seconds of my life. Then finally she said, "I thought you were going to tell me you were really a mermaid, and a sea witch tried to steal your voice. I should mention, my hair is bright red." Then she added, "I hate to inform you, but you are absolutely, positively, blandly normal. You don't pass the crazy test. Sorry." And that moment changed everything for me. For the first time, I didn't feel crazy. I felt seen. She's still my therapist, and she's damn good at her job. Story 12. People are often afraid to admit they're depressed or that they have had or currently have suicidal thoughts. The mental health system in America, where I live, makes patients believe there's a big red button waiting to be pushed if they confess to having these thoughts. But in reality, there's a structured process before any action is taken. When someone discloses suicidal thoughts, professionals don't just immediately intervene. We ask a series of questions first. Questions like, how often do you have these thoughts? Do you have an actual plan? Do you want to harm others? Have you ever or are you currently self-harming? Do you have vivid visual thoughts about your death? Do you intend to act on these thoughts? Or are they just passing ideas? In the past 6 months, have you taken any steps toward ending your life? Most of my patients don't actually plan to end their lives. That doesn't mean their thoughts aren't serious, but it does mean they aren't necessarily in immediate danger. The most common thing I hear is, I just want to sleep. I'm so tired. Sometimes I think that if I could sleep forever, all my problems would go away. But I don't actually want to die. For many people, suicidal thoughts stem from the sheer weight of responsibilities, grief, illness, or job loss. Naturally, the more pressure someone is under, the more serious these thoughts can become. In those cases, we pay closer attention to any red flags. New or returning patients are often terrified of being hospitalized, especially those who've already been in a psych ward. And honestly, I get it. Unless you have the money to go somewhere private, state hospitals can be terrible. People often come back more traumatized than before, adding a whole new set of challenges to their treatment. These facilities aren't really designed to heal anyone. They're mostly there to keep people safe in the short term. In extreme cases, hospitalization is necessary, but it's not the automatic response that many fear. What makes me saddest is that we've created an environment where people are afraid to be honest about their thoughts because they worry about being institutionalized. Please don't suffer in silence. Whether you're simply ruminating or seriously considering acting on these thoughts, tell someone, preferably a therapist. This could be a crucial missing piece in your treatment. It might mean adjusting medication or making lifestyle changes. And in some cases, yes, hospitalization, however unpleasant, could save your life. But before any of that is decided, we need to hear it. You deserve to be heard. Story 13. I'm a licensed therapist with over 10 years of experience. Not necessarily weird, but the number one thing I hear from clients is suicidal thoughts. People are often shocked to learn just how common these thoughts are. They think something is wrong with them for struggling with their mental health, when in reality, mental illness is incredibly widespread. In the US, about 1 in 5 people, including children and adolescents, has a diagnosable mental health disorder. The most common are anxiety, depression, bipolar disorder, ADHD, alcohol and substance use disorders. If you're struggling, my best advice is simple. Talk to someone. Be open with your loved ones. See a therapist. There is no shame in reaching out for help. Take care of yourself. You deserve it. Story 14. I'm a psychologist, and my answer to what surprises you as a therapist is everything and also nothing. Of course, I haven't heard everything, but after a certain point in this career, very little surprises me, even when I'm hearing it for the first time. I've worked with people who have committed horrific crimes, including cannibalism and abuse. So in terms of disturbing behaviors, there's not much that phases me anymore. That doesn't mean these issues aren't significant to the people experiencing them, but from a clinical standpoint, they're part of the full spectrum of human psychology. People tell me things they think are shocking or embarrassing, like, I hear voices and see things. I have thoughts about harming myself. I sometimes think about hurting someone else. I have an unusual kink or fetish. I secretly hate my sibling and want them to fail. None of it is too strange. It's all part of the human experience, and that's why I'm here, to talk about it. At this point in my career, I work exclusively with teenage girls. Since I'm a man, I often see new patients hesitate to tell me things, especially about sensitive topics. They worry I'll be uncomfortable or won't understand. Their concerns range from things as common as, I think my depression gets worse during my period, to things that feel deeply personal and private, like, I don't enjoy masturbation as much as I used to, and I don't know why. My job is to help my patients understand that none of this weirds me out, and everything is okay to talk about. So if you're in therapy or thinking about starting, just remember we're here for you. We won't judge. We want to help. Let's talk. Story 15. I'm a therapist now, but when I was a new therapist, I had a client who struggled to open up about his preferences. He enjoyed Kinky S, where he took on a very dominant role with his partner, but it took him a long time to admit it. I could tell he was holding something back, and it was impacting his relationship. Once he finally shared this, we were able to have an open discussion about his relationship as a whole, and it really helped. It's easy to internalize the idea that anything outside of the Sewell norm means there's something wrong with you, but that simply isn't true. This is why it's important to have professionals who are competent in discussing sensuality. For example, consensual BDSM can leave bruises or marks, and people often assume that must mean abuse, which isn't necessarily the case. Similarly, there's a common misconception that being into kink must stem from past trauma. While past experiences can shape a person's interests, they don't define them. Enjoying kink doesn't automatically mean someone has experienced abuse. The more we create a safe space to talk about these topics, the more people can navigate their relationships in a healthy, fulfilling way. Story 16. I've realized that so many of us feel ashamed about things, only to later learn that countless others have had very similar experiences. For example, many millennials who grew up when Comcast first became popular had access to cable's on-demand feature, including channels that weren't necessarily meant for kids. A lot of parents didn't realize those channels were accessible, or they assumed their kids wouldn't know about them. But many kids did find them. A lot of people ended up seeing adult content at a very young age, sometimes developing compulsive behaviors around it. Much like substance use, repeated exposure can create a tolerance, leading to a cycle where more is needed to achieve the same effect. I've come across studies suggesting that millennials have some of the highest rates of pornography addiction, and honestly, I think this early exposure might be part of the reason why. What surprises me most is that I've had conversations with several people who've described almost the exact same experience. It's a topic that isn't talked about much, but it's more common than people realize. Story 17. Shame is one of the biggest obstacles in therapy. It creates a fear of losing control, one that can feel almost unbearable. When someone shares something wrapped in shame, it can feel like placing a fragile, helpless part of themselves in the hands of their therapist. That's why it's so important to find a therapist who isn't just technically skilled, but also deeply talented in creating a safe, non-judgmental space. Through therapy, many people come to realize that they never truly had a choice when it came to the behavior or incident that now carries so much shame. They begin to accept and grieve their psychological state at the time. They recognize that while they would handle things differently today, nothing could have been different then. Forgiving oneself is a key step. Experiencing self-empathy, acknowledging just how difficult and painful life was at the time, is part of the healing process. But the past doesn't simply disappear. Instead, we integrate it into our understanding of ourselves. Healing isn't about erasing the past. It's about learning how to carry it differently. Story 18. I used to work with caregivers of older Asian adults with dementia, and many of them shared a common struggle, feeling completely burned out from everything they do for their loved ones, yet also feeling like they should be doing more. This internal conflict, the constant worry about whether they're good enough as caregivers, is very real, but it's rarely addressed. Societal expectations, especially the cultural emphasis on filial piety, make it difficult for caregivers to talk about their struggles. Many fear that admitting exhaustion or frustration will make them seem like they don't love their parents enough. If you're a caregiver for someone with dementia today, please know that your struggles are real and this is difficult. Burnout is not a failure. It's a sign that you're giving everything you have. Please seek support if you need it. You are not alone in this. Story 19. One of the things people hesitate to admit is that they sometimes have thoughts about seriously harming or even killing someone. A lot of my clients resist telling me this because they assume I'll judge them. But I encourage them to explore this part of themselves, to give it a voice, to listen to it instead of suppressing it. Society tends to favor the suppression of anger, rage, and the more aggressive aspects of our psyche. But all that does is create a box where all the bad thoughts and emotions get locked away. People spend so much energy holding it in that they never actually deal with it. I'm a hypnotherapist, and some of the most transformative sessions I've had involve exploring this shadow part of the subconscious. What's fascinating is that releasing these buried emotions often leads to massive positive changes. An increase in confidence, self-esteem, Sewell energy, drive, ambition, assertiveness, and so much more. People fear that if they open this box, it will consume them. But in reality, confronting these thoughts doesn't destroy their well-being. It enriches it. Story 20. I have antisocial personality disorder, also known as psychopathy, and I've always struggled to explain my experiences to my therapist. I experienced sexual abuse as a child, and it affected me in an unusual way. I have an inclination toward violent sexual gratification, and I struggle with intimacy. But what's always confused me is how my body reacts versus how my mind feels. I'll have intense physical responses, cold sweats, chills, shortness of breath, but I don't experience the emotions that should come with them. It's like watching myself in a movie. I'm completely aware of what's happening. I feel the discomfort in my body, but my thoughts and emotions are absent. Recently, I watched a film that depicted sexual abuse and felt nothing. No reaction at all. But 10 minutes later, as I lay in bed casually scrolling through my phone, I suddenly had a full-blown panic attack. My therapist thinks it's some kind of dissociative response, but I remain completely lucid through it all. Honestly, I'm starting to wonder if I'm going insane. Story 21. I know this is a bit off topic, but seeing so many people here casually discuss therapy has made me feel odd for never having spoken to a therapist, or even wanting to. I've struggled with depression on and off. Medication has helped me through rough patches in the past, and during an especially bad time, when my business was falling apart, I even attempted suicide. Obviously, I failed, or I wouldn't be here now. These days, my life is in a much better place. But even after everything, I've never talked to a professional about it. I understand therapy is beneficial, but it's just never been something I've felt comfortable with. It's unusual to see such a broad range of people, from all ages and backgrounds, who are so open about their experiences with therapy. It makes me wonder, am I okay just getting by without it? Story 22. I don't often get to talk about my profession, but here goes. I used to work at a drug and alcohol rehabilitation center, and one of my clients was a self-proclaimed drug lord. As we worked together, he told me his history, how he got to where he was. During one conversation, he admitted to selling his own sister into trafficking. He described how he had forcibly injected her with sedatives and narcotics, then had several people teach her a lesson. What exactly that meant, he never shared. He told this story with a completely blank expression, only smiling when he reminisced about what he called the good times, which to him meant having enough hero to get through the day. I have no idea where he is now, but meeting him changed my career path. It made me want to work with victims of trafficking. People don't realize that trafficking survivors don't just struggle with the stigma of selling their bodies. They are often also battling drug addictions. And in many cases, those addictions aren't by choice. Many victims were forcibly given chemicals to keep them compliant, making recovery even harder. If people knew how many trafficking survivors are fighting addictions they never wanted, I think they'd be floored. Story 23. There's been a lot of discussion here about pedophilia as one of the hardest things to not judge, despite our professional training. I've never treated a pedophile, at least not one who openly identified as such. But I did run a men's anger management group, and some of those men had done horrible things to women. Most of them, despite their pasts, I found ways to respect and even admire for their willingness to change. But there were two men in that group I simply could not find unconditional positive regard for. One of them barely spoke. He would only give one-word answers and occasionally rant about how unfair the system was to him. I tried hard to get him to open up, to connect with me, with the group, but he refused. Then one day he left the group entirely. The reason? He had strangled his girlfriend and gone to jail. She survived, thankfully. The other was just as unwilling to engage. He would show up late, leave early, and participate as little as possible. One day, after we had explicitly discussed him staying for the full session, he walked out early again. When I told him he wouldn't get credit for attendance, which was court mandated, he threatened me. And here's the weird part. I eventually moved into an apartment completely by chance, right below him. I didn't even know it at first. But I quickly realized because I could hear him screaming at his girlfriend, breaking things and losing control. I called the cops more than once. I judge these men. Maybe they're redeemable, but redemption requires self-exploration, and both of them refused to even try. What's worth noting, though, is how different they felt from so many others in the group. There were men I did find ways to help, men who had done awful things but were genuinely working to change. I could respect them for that. But these two? They never wanted to change, and I have no respect for that. Story 24. As a therapist, when you reach a certain point with a client, when you feel like you can't maintain unconditional positive regard, it's time to consider a referral. Therapeutic rapport is built on trust, and if you can't provide that, it's only fair to be honest and guide the client towards someone who can help them more effectively. One case that stands out for me was a frequent caller to a SUS hotline. Every time he called, he would refuse to give his name or phone number. Instead, he'd say, "You have 10 seconds to convince me not to kill myself, or I'll blow my brains out, and it'll be your fault." Then he'd count down from 10 to 1, and when he reached 1, he'd hang up. I'm sure the entire point was to make the person on the other end of the line feel guilty, or maybe to prove some kind of point. But I had no way of assessing the situation beyond those few seconds on the phone. Still, I have to admit, on the nights he called, especially the first time, I laid in bed thinking, I hope that guy isn't actually dead. Story 25. When I was a teenager, I lived in a household that was emotionally and mentally abusive. People don't always take that kind of abuse seriously, but it was bad enough that a psychiatrist later diagnosed me with PTSD. One day during a verbal fight in the car, my stepdad suddenly stopped and told me, "Get out. We're leaving you on the highway." I wasn't scared. I knew I could just call the police, tell them I'd been abandoned, and my parents would get into serious trouble. So I just said, "Sounds good," and I got out. That's when my mom came after me and started attacking me. When I refused to get back in the car, my stepdad dragged me by the hair, called me a bipolar bihan, and threw me inside. They forced me to see a therapist after that. They told her I had jumped out of a moving car and then attacked my mom when she was just trying to help me. She believed every word they said. She ignored me completely, insisting I needed medication for bipolar disorder. I knew I wasn't bipolar. I knew my emotions were a normal response to being abused. But she glared at me and said, "You're not nearly as smart as you think you are." From that moment on, I refused to say a single word in our sessions. I would just sit there silently while she made snarky, sarcastic remarks before dismissing me. She wasn't there to help me. She was there to help them. When I turned 18, I left home, put myself through college with zero financial help from my family, got a job, and moved to another country, just to be as far away from them as possible. Now I take antidepressants for PTSD, and thankfully the therapists I've had as an adult have been nothing like that horrible woman. But even after all these years, thinking about her still upsets me deeply. Story 26. I'm not a licensed therapist, but I work as a behavioral health technician. I have a psych degree, and my job involves coaching parents to support children with behavioral disorders. From what I've seen, most children don't have a clear-cut mental illness like adults with severe conditions. Instead, they're often just confused or lonely. And the truth is, many of their struggles stem from poverty. If we could lift some of the burdens of financial hardship, things like affordable childcare and livable wages, it would likely reduce the most severe symptoms I saw in many of these kids. I never judged the children, but I did find myself judging some of their parents. Some would drop their kids off with a fix-my-kid attitude and disappear. As a parent myself now, I understand burnout and exhaustion. But at the time, all I could do was provide those kids with 1 hour of what a structured, loving environment looked like. And those were the kids I knew would struggle long-term. I could see it. Many of them would eventually cycle through institutions, shelters, or prisons. But every so often, a parent would show up and ask, "How do I help my child?" Whenever that happened, I practically jumped for joy because that child had someone who loved them enough to fight for them. Story 27. I work in mental health, primarily in acute and crisis settings, and I've been in this field for most of my career. One of the most memorable experiences I've had was with a young person who had significant, ongoing suicidal ideation. They were dealing with a lot, and I spent hours with them, de-escalating, talking through their emotions, and working out a plan for what came next. Later, one of their parents arrived, and with the patient's consent, I sat down with them to explain the situation. I was trying to discuss psychological frameworks and ways they could support their child when, midway through, the parent interrupted me and said, "Is this going to take much longer? I have a show to go and watch." I've never judged my patients. I haven't lived their lives or seen the world through their eyes. But the people around them, the ones who contribute to their suffering through ignorance, selfishness, or outright malice, I judge them. Story 28. Patient perspective here. I had been seeing a therapist for a few months to help with chronic depression and self-harm, along with some pretty intense suicidal ideation. I had tried Suprax in the past, didn't like the side effects, and stopped taking it, but I was finally ready to try something new to supplement therapy. Everyone around me was calling Wellbutrin a miracle and a lifesaver, so I figured I'd give it a shot. Since my therapist couldn't prescribe medication, I booked an appointment with a psychiatrist. During my first session, I explained what I was struggling with, what I was doing to work on it, and what I was looking for in seeking psychiatric care. Now, I do a pretty good job holding myself together in public. I dress well, I maintain a job, and at the time I was living independently. I now live with my partner. All in all, I wear a well-polished mask. I guess it was too good, because barely 20 minutes into our session, the psychiatrist looked at me and said, "I don't think you're depressed, bro." This was our first meeting. I had been sitting in his office for less than half an hour and he was already ready to dismiss my diagnosis. Cool, man, real helpful. Story 29. I'm a man. Between the ages of 7 and 10, I was brutally assaulted multiple times. When I was in my early 20s, I finally tried to get help. I went to a therapist, hoping she could help me process what had happened. At our first session, she asked about my history. I gave her a basic outline of the abuse, nothing overly detailed. But even as I spoke, I could see it in her face. She didn't believe me. She was dismissive, uninterested. Then she asked about my relationship status. At the time, I was in a long-term relationship with a woman who had 2 sons. The moment she heard that, her demeanor completely changed. She demanded my girlfriend's name, the names of the children, and her address. She said she would be immediately contacting social services to ensure that I wasn't abusing them. I can't even begin to explain how much that destroyed me mentally. She had seen something in me that I hadn't. Somehow in her mind, she was certain that I was a danger. I started crying. She looked at me and said, "Pull yourself together." What she didn't know, what she couldn't have known, was how much I hated the kind of people who had hurt me. If I could, I would wipe every last one of them off the planet. I would never, ever, ever inflict that kind of nightmare on another child. I got up and walked out. That day, I came very close to the edge of suicide. I also ended my relationship. I couldn't bear the thought that, even remotely, I might be a risk. That was 21 years ago, and I'm sitting here typing this, still tearing up thinking about it. Because of that one experience, I have never sought therapy again. I survive, but it's not a good kind of survival. Story 30. 2 contexts come to mind. I often work with people in abusive relationships, and it's incredibly common for them to return to their abusive partners after leaving. Some studies show that, on average, someone will go back 7 times before leaving for good. I understand why people go back. It's usually a combination of manipulation, financial control, gaslighting, love, low self-esteem, fear, and more. But man, it is hard to watch and stay neutral. I can express concern for their safety, but I can't just yell, "Please stop going back. What is it going to take?" Like I want to. The other situation isn't about judging the person, but rather about judging OCD itself. OCD is strange. The ways it manifests can be bizarre and unpredictable. Again, I would never judge someone for having intrusive thoughts or engaging in compulsions that, in their mind, are linked to their obsessions. But I do find myself constantly amazed at how creative and complex the human brain can be. Story 31. There was a client, a young teenager, who was hearing voices telling him to harm himself. He had multiple crisis calls and was admitted several times to crisis centers for observation until he was prescribed medication and began showing improvement. He eventually started opening up about possibly being gay, which caused him a lot of stress because his father was very traditional, deeply religious, and a respected figure in the community. He was recommended for treatment at a facility where he could adjust to his medication and develop coping skills. However, his father pulled him out against medical advice and refused to let him continue his treatment. He also discontinued his therapy, opting for a strictly religious approach instead. 3 months later, the young man took his own life. I still see that father around, and I can't help but feel angry. I wish things had turned out differently. Story 32. I'm not a therapist, but I was a patient after my mom passed away. I needed someone to help me process everything I was experiencing in the wake of her death. We were discussing major trauma. I had been abandoned by both parents and suffered severe neglect and abuse from caregivers. At one point, I looked up and saw my therapist had put down her notepad and was staring at me, wide-eyed. I thought she was going to diagnose me with something or tell me I was beyond help. There was a long pause before she finally said, "You need to realize how special you are. You did it. You could have been just another statistic, but you beat the odds. Do you mind if we go deeper into your childhood? Understanding your perspective might help me support other patients." That was a remarkable moment for me. She didn't just tell me I was normal, she told me I was exceptional. We worked together for 8 months using cognitive behavioral therapy to address my triggers and attachment issues. She helped put me on a path to healing. I'll always be grateful to her. She's an incredible person who found value in my painful past and, in a way, helped me use it to support others. Story 33. I'm a licensed psychologist. As many have said, judgment isn't part of the job if you've had proper training and done the internal work required for this profession. That being said, not all therapists have done that, so don't be afraid to stop seeing one if it doesn't feel like a good fit. I often tell clients that I see my role as a navigator while they are the captain. I've been hired to help chart a course from where they are to where they want to be. I understand the waters and the landscape, psychology, human behavior, habits, and so on, but they are the experts on their own boat and crew, themselves, their lives, and their relationships. I don't expect them to take every piece of advice or tool I offer because they know things about their journey that I don't, and I respect that. My job is simply to help adjust the courses needed to avoid obstacles or deal with them when they arise. It's not my job to tell them how to live, what to do, or to judge them when they make choices, even if those choices differ from what we discussed. It's their boat. However, I always add this. If I suggest 20 tools or strategies and none of them are used, but they continue to come in frustrated about feeling stuck, then that's a different conversation. It's still their choice, but I'll point out the pattern with as much respect as possible. Even then, it's not about judgment. It's about recognizing the cycle and understanding what's preventing progress. Story 34. I'm a licensed clinical psychologist, and much of my work focuses on helping clients move away from judgment. Whether it's about their performance as employees, their value as parents or partners, or their overall self-worth. Honestly, my biggest realizations come from seeing just how deeply ingrained our tendency to judge is. No matter how accomplished or resilient someone is, they often judge themselves incredibly harshly. The irony is that we tend to judge ourselves far more critically than others ever would. What amazes me most is how blind people can be to their own achievements and strengths, yet so quick to be unkind to themselves. My role in these situations is to help them see themselves with compassion, to encourage them to treat themselves the way they would treat a loved one. It sounds simple, but it's not easy, and I love every moment of that work. I doubt this is the kind of response the original post was looking for, but it's what comes to mind. Judgment is a basic human function. It's how we categorize people, ideas, and experiences as good or bad. It happens constantly and almost automatically. The problem is that we tend to believe our judgments as absolute truth. But judgments are just thoughts, and like all thoughts, they aren't necessarily true. Helping people recognize their own judgments and either challenge or let go of them is a skill they can develop over a lifetime. Story 35. I'm a licensed therapist, and I agree with what someone else mentioned. I really don't judge my clients. We're trained to switch off that kind of thinking. I believe that the people who get into this field, at least the ones who should be here, because to be honest, I've met plenty of therapists I wouldn't send a loved one to, are naturally open-minded to begin with. That being said, if some of my friends or family members made the same choices that some clients have told me about, I would probably judge them. But that's because in my personal life, I'm in a subjective role. As a therapist, my role is to remain objective. That's the whole reason people seek therapy in the first place. This doesn't mean I haven't had moments where I think, wow, this is wild. But that's different from judgment. It's such a strange yet incredible job. There's also a big difference between judging and expressing concern. It has to be worded carefully so that a client doesn't feel judged, because the moment they do, you risk losing their trust and their willingness to be vulnerable. If you find yourself struggling not to judge a client and can't work through your own biases, that's when you refer them to someone else who may be better suited to help them. Story 36. I'm a registered psychologist, and this is something we are trained to handle. Our ethics, code of conduct, standards of practice, and even our own moral compass are all things we must reflect on daily. During my oral ethics exam, this was a key question, and you cannot answer. I would never judge anyone. I accept every single person. That's not realistic because at the end of the day, we're human too. We have feelings, emotions, reactions, just like anyone else. My response was honest. I admitted that I would struggle to work with someone who willingly and purposefully tortures and harms animals for enjoyment. I told the panel that it would be difficult for me not to pass judgment on an animal abuser. That was actually the correct answer. Psychologists are expected to recognize the specific populations they may struggle to serve competently. The goal isn't to pretend we don't have biases, it's to be self-aware enough to handle them appropriately. Story 37. Obligatory disclaimer. I'm not a therapist, and this will probably get buried, but as a man, I really struggled with the idea of going to therapy. It was the lowest point in my life. I had always dealt with depression, but I came from the just get through it mentality. Well, I was getting closer and closer to not getting through it. I remember the first time I told my therapist that I was planning to end my life. I expected the same reaction that men often get when they show emotion or vulnerability, but she never dismissed me. Never even acted like it wasn't an option. She just talked me through it, never making me feel like my thoughts or feelings were invalid. Sorry, I know this isn't exactly the point of the question, but if fear of being judged is holding you back from seeking help, please go. It could save your life. Story 38. It's never the things people think they're being judged for. A good therapist isn't judging you for how much of a substance you use, how harmful your coping skills are, or the things you've done that you're ashamed of. We exist to hear, recognize, and help you through these things. You are worth it. Having someone see your value despite everything you've been through is important. But I do judge parents who don't care about their kids. And I don't mean the ones who are trying, the ones working to break generational cycles, even if they make mistakes along the way. I'm talking about the parents who 100% do not care and actively make their child's life worse. As a child therapist, that's my breaking point. That's when the judgment comes rolling in. Kids deserve better. Story 39. As a student, I had a professor who was a practicing forensic psychologist. One day, he told our class about a case that still haunts me. He had been evaluating two parents and their second child after their first child had died by suicide. I don't remember all the details, but what I do remember is horrifying. The parents were indifferent to both children. They ignored their first child's depression and struggles completely. After that child's death, they remained detached, never acknowledging any underlying issues. Instead of learning from the tragedy, they continued to ignore their second child and his developing mental health problems. It got so bad that the second child also ended his life. Even then, the parents were still indifferent, completely unfazed, never recognizing any fault or responsibility. The worst part? They later spoke to the therapist about wanting to have another child, without changing anything about themselves or their approach to parenting. Story 40. When I first started college, I wanted to become a social worker. I was lucky to have an incredible professor for my introductory classes. He had been a social worker for over 35 years and had served as the head of the offender probation unit in a major county. He was even involved in the case that led to the creation of the Amber Alert system, working closely with Amber's mother. He was brutally honest with us students, bringing in speakers to help us understand what the job was really like. By the end of his class, I realized that social work wasn't the right path for me. I simply don't have the emotional strength required to work with and help abusers. But I'm forever grateful for the knowledge and firsthand stories he shared. They horrified me, but they also changed my perspective. Instead of becoming a social worker, I've decided that I will become a foster parent as soon as I'm able. That's how I'll contribute. By providing a safe, loving home where no child will have to suffer, I will protect and care for them with everything I have. Story 41. I'm a therapist, and this happened early in my career. I worked at a recovery center for families, and one family we received had a mother with multiple diagnoses: borderline personality disorder, dissociative disorder, and complex PTSD. She also had domestic and battery charges in her past, as well as a history of addiction. She had a couple of children, and part of the program was about relearning how to interact with them in a healthy way, focusing on parental strengths. At the time, I was fresh out of my master's program, and in all honesty, completely out of my depth. One of the kids had taken on the role of what we call the channeler, absorbing and reflecting all the anger, sadness, and rage of the mother onto everyone else. We worked with her to try to change the way she interacted with her children, encouraging her to communicate in ways other than screaming, which was her default for everything, or using physical restraint. But she struggled to grasp it. She was in trauma therapy, but processing was difficult for her. One day we were out on a walk when, out of nowhere, she suddenly body slammed her child onto the concrete. The other staff member and I were in complete shock. This child was only 6 years old and just looked so scared and heartbroken. And in that moment, I judged. Story 42. I'm not a therapist, but I had a similar experience. Back in June, I hung out with a friend I hadn't seen in about 8 months. She had been arrested just a few days prior for destroying her boyfriend's belongings. Their relationship was extremely toxic and abusive on both sides. When we met up, she seemed completely different. Paranoid, constantly taking pictures of people. She would take selfies, but intentionally capture others in the background, trying to be sneaky, but it was obvious. Eventually, I asked her what was going on. At first, she hesitated, saying I wouldn't believe her, but I assured her that I would listen. That's when she told me that her boyfriend was the leader of an underground secret society, something like the Illuminati. According to her, he was manufacturing an unknown drug that didn't show up on tests and was using it to harm her and traffic her to strangers. She said this was why she was taking photos of everyone. She was convinced they knew her boyfriend and would report back to him. I was completely freaked out. I honestly believed she was experiencing a psychotic break or possibly schizophrenia. But the worst part wasn't her delusion. It was her mother's reaction. Later that night, my friend went to the ER because she was suicidal. Since she had taken the only car, I picked up her mom and we drove to the hospital. Due to COVID restrictions, we couldn't go in, but we called and verified she was there. A nurse preparing to do her psych evaluation asked if we had concerns or if she had a history of mental illness. Her mom's response? Just suicidal. I knew there was something much deeper happening, so I told the nurse everything I had observed. That's when her mother absolutely lost it, screaming at me, furious that I had spoken up. And then she accused me of ruining their vacation. They had plane tickets to Florida in 3 days, and now her daughter was being admitted to a psychiatric hospital. I couldn't believe it. Her mom cared more about a vacation than her daughter's well-being. We haven't spoken since, but I don't regret it. She can hate me all she wants, but her daughter desperately needed help. Story 43. After working with a client for 2 months in an inpatient treatment program for substance use, I truly believed he was making progress. He had been talking about real changes and discussing his goals for the future. Then in our next session, he told me that the real reason he had so many issues in life wasn't the meth use. It was his mother. I listened, thinking we were about to dive into some deep insight about his childhood or their relationship. Instead, he said, if my mom wasn't such a terrible person, I'd be living in her house right now. I asked why she wouldn't allow him to live with her, and he replied, she won't let me use meth in the house. I don't understand. That's like telling her she can't take her heart meds. Internally, I was screaming, what? Meth will kill you, and you're comparing it to your mom's heart medication? You were so far past this yesterday. But out loud, all I said was, okay, let's explore that a little more. Story 44. During my graduate program, in one of our first semester classes, the professor asked us to reflect on our personal values and share what types of clients, if any, we would be uncomfortable working with. One student said, gay people, explaining that he was personally disgusted by them. Another said her religious beliefs would not allow her to serve a client considering an abortion. The professor thanked them for their honesty, gently reminded them of their professional duties under the NASBU Code of Ethics, and ultimately validated their right to refer out clients if their biases might interfere with competent care. Fast forward a year to my internship. I was assigned weekly one-on-one sessions with a client who had rejected every other therapist at the agency. I was told I was a perfect fit, but wasn't given any explanation. The moment I met her, it became painfully clear why I was chosen. She was a white supremacist, and I am white. Every other therapist she had met with at the agency was either Latino or African American, and she had refused to work with them. After the session, I met with my on-site supervisor and explained that I had been assigned to counsel a white supremacist. I told her that white supremacy was fundamentally against my values, and I did not believe I could provide unbiased care. Given what I had learned in my first-year class, I assumed they would thank me for my honesty and reassign the client. That did not happen. Instead, I received major pushback. I was told I had to continue seeing her, that it would be a learning and growth experience for me. I had no choice. If I wanted to keep my internship and complete my required hours, I had to work with her. It was an incredibly difficult year, one that still stays with me. Story 45. Obligatory disclaimer. I'm not a therapist, but I was the patient. A few years after a serious car accident, I was left in crippling, severe chronic pain every single day. I was struggling to cope and had reached the point where I was preparing to end my life. It had been years, and not only had the pain not improved, but it had actually gotten worse. The doctors either couldn't or wouldn't do anything, not even prescribe pain medication. Despite how unbearable it was, I had reached my limit. As a last resort, I decided to meet with a psychologist. Not because I had any hope left, but because I didn't want to hurt my mom in the way that my death would. So I tried. I told him everything about the pain, the exhaustion, and how I felt that suicide was the only escape I had left. His response? He told me to do it. He said I should stop complaining and just go through with it. He told me to cut the theatrics of saying I didn't want to hurt my family because, in his words, I was obviously just looking for attention. He told me to grow up and either stop whining or follow through. So I left his office, went home, tied a rope to the rafters, put the other end around my neck, and kicked the stool out from under me. My stepdad came home early. He found me just as I was losing consciousness, cut me down, and called an ambulance. I survived. Later, when I was asked why I had done it, I told the psychiatrists and doctors exactly what had happened. They were horrified. They reported the psychologist and confronted him. His excuse? He had been using reverse psychology to show me that I didn't really want to die. I just wanted to feel better. He claimed he had miscalculated the seriousness of my situation, and they bought it. He wasn't punished. He wasn't even reprimanded. And that was the day I lost all faith in the system. Story 46. I'm a client, but you can always tell when a therapist is judging you, and when it happens, it sticks with you. Over the summer, I had to see a new therapist since my usual one was a free campus counselor, and I had to pay out of pocket. She was nice and good at her job, but sometimes a therapist just isn't the right fit. I stuck with her, though. I had already spent a month explaining my trauma and situation, and I only had one more month before I could return to my regular therapist. One day, I was explaining my struggles with therapy, and I said, growing up, I always wanted help. The moment I started understanding what I was going through, I wanted therapy. I didn't want to become a monster. I didn't want to hurt myself or others. I wanted to grow. But now that I have all the resources in front of me, now that I'm being handed everything I need to get better, I don't want to anymore. I don't deserve this. And she made a sound, a little awe sound, like she pitied me. I study psychology. I want to be a therapist one day. And I know that you are not supposed to do that. It hit me hard. She pitied me. And from that moment on, therapy felt different. Story 47. I'm a psychologist and I try really hard not to judge. For the most part, I do pretty well. Everyone has their own struggles, and it's not my job to judge, only to help. However, early in my career, I had a patient with significant personality issues. He had a very rocky marriage with infidelity on both sides. We were discussing how this had affected him over the years when he suddenly revealed that he had a threesome with his wife and his brother as payment for a loan his brother had given him. I did my best to keep my reaction neutral, but I wasn't very successful. From that point on, he kept pushing therapeutic boundaries until I had to terminate our sessions and refer him elsewhere. About a month later, I was working with another patient struggling with self-esteem issues. Out of nowhere, he revealed that he had also had a threesome with his wife and his brother. At that point, I did a much better job at controlling my reaction. But seriously, what? 2 patients in a month? I haven't had that come up since, but now I can't help but wonder how common this is. Later, I worked in a prison for a while, and after that, I don't think much could shock me anymore. Story 48. I'm a licensed therapist, and as previously stated, a big part of being effective in this field is listening with empathy and without judgment. There have been times when clients have made choices I wouldn't personally make, but it's critical to look at the bigger picture of why they do what they do. Unhealthy and maladaptive coping mechanisms don't exist without reason. They serve a function, often something that was necessary for survival at some point, but has since become damaging. Our clients usually seek therapy because they don't know what else to do. If we aren't an open, judgment-free space for them, how can we expect them to feel comfortable enough to be vulnerable and open to change?